Okay, good afternoon. This is our G4 project on the endocrine system. My name is Aspasia.
I'm Archana.
I'm Sabrina.
I'm Carolina.
I'm Jada.
I'm Isha.
I'm Kelsey.
And I'm Gina.
Today we'll be discussing IB Bio part of this project, and in specific we're going to be discussing type 2 versus type 1 diabetes. This is a picture of type 1 diabetes, and this is a picture of type 2 diabetes, and similarly same thing as glucose and insulin.
Okay, the first subtopic that I'm going to be talking about is diabetes 1. It's also called juvenile diabetes, and it can occur at any time in one's life, and a majority of children and young adults get diagnosed with this disease. And 5% of diabetic patients have this type, and the sugars and starches that the body consumes while eating gets broken down into glucose, a simple sugar, to be converted into ATP. And ATP is the molecule that stores the energy in order for us to do our basic life functions. And type 1 diabetics cannot make insulin. They have a higher than normal amount of glucose in their blood, and insulin is a hormone that is able to take the glucose from the bloodstream into the cells of your body. Okay, a couple of symptoms of diabetes type 1 is blurred vision, polydipsia, which is excessive thirst, polyphagia, which is the opposite, loss of weight, feeling of weariness, sores heal slowly, irregular infections, example in the skin or in the gums, and hyperglycemia. Okay, so one of the therapies for type 1 diabetes is healthy eating to stabilize the levels of glucose, and refraining from things such as processed carbohydrates and sweets. Another therapy is physical activity, so which is helpful because it allows the glucose to be moved from the bloodstream into the cells of the body without much insulin. So activities include running, biking. Other therapies for type 1 diabetes include pancreas transplant, although this is not as common because the drugs that are given, so the immune suppressing drugs can have more damaging side effects, and insulin therapy usually taken with an insulin pen and pump or syringe. Next.
Okay. Type 2 diabetes is different from type 1 because adult onset diabetes, which means that they usually get it when you're older. And this type of diabetes affects the way your body uses glucose because it uses it very ineffectively. And the patient tends to have insulin resistance because the patient, once again, the patient's cells is not using glucose effectively. And this is a more common type of diabetes because about 90-95% of people who have diabetes have this type in the US. The main two causes of type 2 diabetes is obesity and lack of physical activity. So symptoms of type 2 diabetes: increased thirst, which is polydipsia, polyphagia, which is increased hunger, and then dry mouth, frequent urination, unexplained weight loss, fatigue, blurred vision because the nerves are being damaged, headaches, and loss of consciousness, which is very rare and is very severe conditions. The treatment for diabetes is pretty simple. It is mostly managing your diet, having a very balanced diet, and a healthy diet will help you reduce this type 2, and also exercise helps type 2 diabetes it helps your blood circulation, which once again helps type 2 diabetes because you're using glucose more effectively. Also, medication can work together to bring your blood sugar level down along with these two choices, diet and exercise. The main risk factors for this type 2 is that it's usually genetic factors because it runs in the family. But you can also have prediabetes, which is very similar to diabetes because it shows the same symptoms, but you don't actually have the disease yet. So this is a sign that you should be taking care of your diet. And also, you're not physically active, overweight, And also, many people who have this disease usually had heart disease earlier in their life, and they also had high blood pressure too.
And the second topic for IB biology is endocrine cells and diabetes. So the main cells are beta cells, and what they are types of cells that are found in the pancreas, and they take up from 65 to about 80% of the pancreatic islets. And these cells secrete amylin, C-peptide, and insulin.
Insulin regulates the sugar in blood, making sure it does not get too low or too high. It acts as an equalizer. It does this by attaching the signal cells to absorb the sugar from the bloodstream into the cell, which allows sugar to be used as energy. The second hormone is amylin. Amylin works as a partner to insulin, almost as its buddy. And this slows digestion, slows the glucagon secretion, and enhances satiety. Makes insulin's job much easier since there are no glucose levels spiking after eating. The last hormone is C-peptide. When proinsulin is secreted, it splits into C-peptide and insulin. This helps to prevent neuropathy by building up muscle tissue that surrounds the arteries.
So in diabetes type 1, the beta cells are killed by the body's immune system. And since beta cells are necessary for the protection and production of insulin, amylin, and C-peptide, these chemicals are not then able to regulate the blood sugar. And in type 2 diabetes, the beta cells are not able to secrete sufficient amounts of insulin, amylin, or C-peptide. And again, these chemicals are really necessary to regulate the sugar in the blood, so oftentimes injections are needed to keep the sugar level at a constant level.
Next subtopic in biology is diabetes in dogs. Dogs are some of our closest companions, and that is why we chose to do this.
So dogs at risk for diabetes, well, the exact cause is unknown, but possible causes are other diseases such as chronic pancreatitis, or sometimes dogs get certain medications which react unwell within their system, so that can also cause diabetes. While other theories are that there's abnormal protein deposits in their pancreas, which is right here, and obesity. Older dogs are at higher risk of diabetes, and unspayed female dogs are also at higher risk, as well as dogs with steroids. Some higher risk breeds of dogs that we found are the Samoyed, the Keeshonds, Poodle, Dachshund, Australian Terrier, and Mini Schnauzers.
For the symptoms of diabetes in dogs, early ones include excessive thirst, increased urination, weight loss, and increased appetite. The more advanced ones include loss of appetite, lacking of energy, depressed attitude, and vomiting. The reason why we have excessive thirst and a lot of urination is because they constantly drink in water to try to flush out all of the sugars that they don't need or have, and drinking a lot of water of course increases urination. Weight loss happens because they are eating and not enough food, they're not processing the food, so they're just losing weight as they go, and they increase their appetite trying to gain those sugars that they don't have.
So treatment for the dogs varies by the type of diabetes that they have. So for type 1 diabetes, dogs get daily insulin shots, and their diet can change, so that way your veterinarian might recommend a different brand of dog food or a specific blend for your dog. And then the last treatment for type 1 diabetes is exercise, so you can simply take your dog outside and have them work out and play with you.
The trends for diabetes in dogs include type 1 or insulin deficiency in diabetes, and it is the most common among all the dogs. There is a correlation between small dogs and diabetes, as you can see in the other slide. Most of the dogs who commonly had diabetes were smaller dogs.
The next topic is physics and diabetes. So the thyroid is a gland in the endocrine system, and one of its major functions is to regulate the basal metabolic rate, and it's directly correlated to diabetes because of this. So studies have shown that there are differences Oh, and thyroid, people with diabetes and people who are healthy. So for instance, people with diabetes, they tend to have a higher gland dimensions in their thyroid. Also, people with diabetes who don't receive a lot of treatment, they tend to have a higher volume in the thyroid. And people, especially for type 2 diabetics, their thyroid is more in a nodular structure and has nodules in it, as shown here. So for the ultrasound, there's a transducer, which is a probe that produces sound waves with high frequencies that go beyond the human hearing threshold. The transducer is able to detect the rebounding sound or the echoes. So there's specular echoes and scattered echoes. The specular echoes are the ones that reflect off the large and smooth surfaces that are regularly shaped objects. And then scattered are the ones with small surfaces that are weak and irregularly shaped. And with this, the computer can create an image. So in ultrasound, it involves sound waves, and the sound waves are mechanical and longitudinal. So mechanical means that the wave propagates through the medium, in this case, the thyroid, and through the particle interaction, it creates the sound. Longitudinal means that the displacement of the particles of the medium is parallel to the direction that the wave goes, so the wave moves side to side. So some benefits of the ultrasound are that it's safe to use, so unlike CAT scans and x-rays, there's no radiation. And then it's also painless, so there's no injections involved. Unlike CAT scans, x-rays, MRIs, these are really not that expensive as these other scans. And it can be used multiple times because there's not a lot of there's no radiation involved, so there's no harmful effects from the ultrasound. So the images from the ultrasound can show structure, movement, and blood flow. And since the ultrasound is sensitive, it can show any nodules in the thyroid. This is an example of a Doppler ultrasound, which makes the sound turn into colors, and the color can show the speed and the direction of blood flow.
That's the IB chemistry side of diabetes. Diabetes treatment can be affected by what you eat, how much you exercise, and also where the insulin is injected into your body. For the best and most bioavailable amount of insulin, you should inject it into your stomach. Other reasons, when you take your insulin injections also affects this, as well as illnesses and stress. These can all affect how well insulin works. Insulin is a naturally occurring hormone that is secreted by the pancreas. And your body, there's two types of diabetes, type 1 and type 2. Type 1 is where your body doesn't produce enough insulin, and type 2 is where it isn't produced properly. The most common form of injecting insulin is via a syringe and an intravenous injection, which means it's injected directly into the bloodstream. And there's also other options like insulin pumps, but they're not as common. The most common is a syringe. The intended physiological effects are that it facilitates the entry of glucose into the muscle, and it also into several other tissues, and it stimulates the liver to store glucose to form oxygen, or to form glycogen. It's polar. The molecule of the insulin itself is polar, and this makes it more bioavailable since it goes directly into the bloodstream. And it decreases the concentration of glucose in blood, but some side effects are a lot of people are allergic to insulin as well as to aspirin, which is another medication that you can use when you have diabetes. Dosage for insulin is U100, which means it has 100 units of insulin per milliliter of fluid. There's other dosages that are higher if you are more resistant to insulin, but for the most part, U100 is what's used. Insulin administration, subcutaneous injection. Inject insulin via subcutaneous injection, which is under the skin, for maximum bioavailability, which means most of it gets into your bloodstream and is able to do its job. It should be injected in the same general area, preferably the abdomen, but you shouldn't put it in the same exact place. It should be varied throughout that general region. And it should be timed with meals so that way it effectively processes the glucose like it should. Otherwise, the insulin doesn't work like it should as effectively. Now there's some environmental concerns with this. With syringe disposal, you need to make sure that you put it in biohazard containers, which you can usually get from your doctor. And there's many drop-off locations depending on your community and where you live. There's drop-off supervised collections, household hazardous waste collection sites, mail back programs, residential special waste pickup services. It all depends on the area. The reason for this is because the syringe is considered to be a medical waste because of the risk for infection that could occur should it not be disposed of properly. Aspirin is also used with insulin, and especially if you have diabetes, because when you have diabetes, your blood is prone to clotting, and aspirin is an anticoagulant, which means it's a blood thinner. So this means that it will help reduce your risk of heart attacks and strokes, which are common in people who have diabetes. It has a carboxylic acid and an ester functional group. This is the carboxylic acid, and this is the ester right here, and this is very helpful in making sure that the molecule is polar, which is what makes it more bioavailable since it goes into the bloodstream and it doesn't affect the brain. Some side effects, many again are allergic to it, so you have to be careful. It correlates with asthma. Sometimes people who have asthma are more prone to be allergic to it. Also, you shouldn't use aspirin if you're 12 or under because of the possibility of getting Ray's syndrome. There's also the possibilities of stomach bleeding, and you shouldn't be taken with alcohol because it amplifies the effects and is very dangerous.
Real quick